Hi, everyone from around the globe. My name is Chisato Calvert, and I'm the Deputy Director of OpenAQ. Welcome to today's Community Series webinar, Air Quality State of Play, Openness of Data, Tools, and COVID-19. This event is actually part of a broader community series that highlights important topics in the air quality field. And today we have a really exciting lineup of presentations. OpenAQ's director, Christ Hasenkopf, will be presenting on open air quality data, the global state of play, followed by OpenAQ platform lead, Sruti Modekurty, who will be sharing on the averaging tool that's available on the OpenAQ platform. And Professor Michael Brauer, Faculty of Medicine and the School of Population and Public Health at the University of British Columbia, who will be presenting on the relationship between COVID-19, air quality, and health. Just to cover some logistics, this webinar will be recorded and we'll be sharing this out after the conclusion of the event via email to confirm participants, and we'll be posting on social media platforms as well. And as a participant, you will be put on mute throughout the webinar, but we encourage you to submit your comments and questions in real time in the chat box. You'll see that at the bottom of the screen. And feel free to type in questions to specific speakers. We'll have about 5 minutes for a question and answer period following the presentations. So before diving into the presentations, I wanted to share a little bit about OpenAQ as an organization. OpenAQ is an environmental tech nonprofit that has created the world's first open, real-time, and historical air quality platform, aggregating governmental and research-grade data entirely open source. We have aggregated more than 570 million air quality measurements from 147 data sources in 93 countries across the globe. And the platform is receiving traffic from 162 countries, serving 35 million requests per month. And by providing this foundational data infrastructure, OpenAQ is able to convene people and organizations from across the globe, including scientists, journalists, educators, entrepreneurs, and community activists, to further awareness building and develop innovative solutions to combat air pollution. So without further ado, I'd like to introduce our first speaker, Christ Hasenkopf, who will be sharing with us about global air quality.
Thanks, Chisato, and hello, everyone. As Chisato said, my name is Christ Hasenkopf. I'm the director and co-founder of OpenAQ, and I'm really excited to share with you a preview of some work we have been doing on open air quality data, the global state of play. This is a report we're releasing next week, and I'll call out if you'd like to receive a copy of that report. You can find it at thetinyurl.com listed there below to get your copy. And I want to thank our supporters first for helping make this work possible. That's Bloomberg Philanthropies, Clean Air Fund, and ClimateWorks Foundation. And also a huge shout out to the OpenAQ community and several specific contributors who have helped make this report possible. I'll also flag that any errors, omissions, or opinions belong to OpenAQ and don't belong to these folks. And I'll also flag that this is a work in progress. This is our first iteration. We welcome your contributions and support in future iterations as this landscape evolves. And lastly, but importantly, I want to thank the OpenAQ team, both Chisato and Sruti, who have helped make this report possible. So with that, we'll do a whirlwind preview of the report, and we'll cover the motivation for why we think this report and capturing this landscape is important, why specifically we're focusing on government data, the methodology we applied, and the 4 criteria we developed to define what fully open data provided by a government looks like. We'll mention some key findings and end with a recommendation. So the motivation for this work mirrors much of OpenAQ's mission in the first place, and it's that data sharing infrastructure is invisible, but it's foundational for solving air pollution or really many issues. And just like the most high-flying skyscrapers require foundations, the most effective solutions for air pollution require access to data. And when you think of most solutions or most ways to tackle air pollution at their base level, some aspect involves access to basic air quality data. So for things like understanding health and environmental and economic impacts of air quality, all the way down to measuring whether air pollution has improved or not improved after taking a particular policy action. That all depends upon the ability of different groups to access existing air quality data. Put another way, even more simply, the openness of the air quality data sharing landscape impacts how much awesome work can happen. So why we're specifically focusing on government air quality open data in this report is fourfold. One, governments often do the hard and good work of creating sustained air quality data archives. So on year-by-year scales, not short intervals. Secondly, typically the data can be provided in a timely manner instead of in near real time or real time, as opposed to, say, a year after it's been produced. Government produced data of really any sort is of natural public interest. And there's a uniformity for the general purpose across countries' governments for monitoring air quality. And typically the similar pollutants are measured from place to place, as opposed to say a research study, which produces awesome data, but might have a specific purpose in one place, in one country, or even one locality compared to another place. So the methodology we used is first we meant to address the first question here, which is what countries have a public national level government air quality monitoring program that generates air quality data for the public. And we looked at publicly available data sources. So we looked at the 2018 WHO Ambient Air Pollution Database. We also looked at publicly available government websites, and we sourced those through a few different ways. One is through another air quality data aggregator, aqicn.org, as well as OpenAQ, and also issues in OpenAQ's GitHub project, where there may be sources for different data sources that community members have mentioned but are not yet on OpenAQ. We also made some queries to the community, but just to flag, word of mouth didn't count unless we could find a verified government website. So again, in this first iteration, this is what we used, and we're looking for community to help augment these sources in the future to build this landscape. So the second piece, the second question we asked is, for the countries that generate national level public air quality data, are the data open enough so that others can seamlessly build on top of the data to achieve their full impact? So we did that by developing 4 key criteria that, if met, describe a fully open air quality government data source. So I'm briefly going to go through those 4 criteria. The first one is that the data are shared in terms of their physical form. So as opposed to, or in addition to, an air quality index or air pollution index type quantity, the physical data is made available. Since air quality index type values vary from country to country, or perhaps organization to organization, whereas the physical data is the same quantity from place to place. The second criterion is that the data is station specific. So the data is provided at the most transparent geographic scale possible at the station level, as opposed to averaged across different stations in a city or in a region. And that they're also provided with geo coordinates, ideally to 5 places past the decimal. The third criterion is that the data is timely and is provided in a fine scale temporal way. So data are provided at daily or sub-daily levels with a time of collection stamp and an averaging period associated with it. And then the fourth one is hugely important, and it's around programmatic access. So we find from OpenAQ that many data sources from governments across the world do meet those first 3 criteria, but perhaps there's not a publicly accessible way to access, a programmatic way to access that information in a predictable or machine readable form. So we'll take a pause here and just dive a little bit deeper into what programmatic access means. And it can vary from place to place. It can be an open and well-documented API. It could be an FTP server. 2 great examples we've seen across governments so that others can build on top of the data seamlessly through programmatic access include Taiwan. So their environmental agency has a beautiful graphic where the air quality index values are shared, as well as an open API where the physical data can be accessed and other people and other organizations can build on top of that data for more uses. Another example is through the AQ monitoring system at US diplomatic facilities on US EPA's Air Now site. So they have a beautiful interface where you can see that data in a very friendly, user-friendly manner. But there's also a more technical way where you can access the data in a machine-readable, predictable fashion via simple XML files. Both ways help make the data so that others can build on top of it more seamlessly. So we applied these public resources and the 4 criteria I outlined to 212 governments to determine the existing global air quality open data landscape. So I'm going to go over 4 key findings, but again, if you would like the full report with the 212 different countries, there's the URL there at the bottom where you can sign up to our listserv to get the report. So the first finding is we found that half of the world's governments produce public air quality data, which is awesome. But to note, 1.4 billion people are not within countries where they can access this sort of data. Finding 2 is that 4 out of 10 governments share real-time air quality data, which is also fantastic, but this still leaves 2.1 billion people without access to such data, and often in more highly polluted places across the world. So finding 3, we found that investing in public government air quality monitoring programs where they appear to either not exist or at least have a limited public profile in just 13 countries could affect 1 billion people. And finding 4, at least 30 governments generate real-time air quality data, but don't yet share them in a fully open manner. So making these data more fully open could affect 4.4 billion people. And a great example of 2 data sources where they produce a ton of wonderful public data for the world is India and China. They make a huge amount of air quality data publicly available. They account for about 20% of the stations on OpenAQ. So 2 countries are 20% of the 93 countries available. So a huge amount of data. However, the physical data aren't programmatically available for these 2 countries and 28 more. And that limits their ability to be fully accessed and utilized on a reliable basis. And I think something interesting with improving data access, data sharing infrastructure is that many patterns do exist to enable programmatic access to these types of data. It doesn't require new technologies. There are other barriers, but enabling this access can be a low-hanging fruit in terms of the cost of implementing that data sharing infrastructure relative to the cost of the physical infrastructure that's already been invested in. So to end, our recommendation is that organizations and governments that support air quality programs can ensure their investments promote data transparency and openness so that the full potential of the impact of the data can be unlocked by communities across the world. And with that, I just want to emphasize this report is designed to be repeated and improved over time and to gauge how openness evolves in the global air quality data landscape. We would love your help in doing that. If you're a government official or a citizen who would like to contribute to the report, we'd love to hear from you. And again, if you'd like a copy of the report, please sign up to OpenAQ's listserv at that URL right there. And thank you again to our supporters and our community for helping make this work possible.
Thanks so much, Krista, for such a thought-provoking presentation. A couple of questions. I think that given the work in data infrastructure is encompassing government work, I'm wondering from your perspective, what are some of the barriers that you see for governments that prevent them from really opening up their data, and what are some ways that we might be able to address this or confront this?
Yeah, that's a good question. And I think, I mentioned technically the barrier for data sharing infrastructure isn't huge, but there's still significant barriers. I have a slide here that talks about a few of them. Sometimes a technical barrier can be sort of the definition of what counts as data being open. And often, whether having data on a website in a perhaps non-machinable way is open or not. So sometimes there's technical issues. And one hope in doing this report is that we're defining some key criteria that help governments and other organizations identify sort of very granularly and concretely what it means to make the data fully open. Sometimes there's social barriers as well. There's concerns about data misusage or misattribution or negative press and political sensitivities. And I there's no quick solutions to those, though we have found that the more data is open in various places across the world, the more willingness and interest there is to make that data open. And there are monetary issues. It's not, it does, while it's a small cost relative to the hardware and the infrastructure put in place to monitor air quality, data sharing infrastructure does cost something. And so if there's not specific funds allocated to that, that can sometimes be a barrier too. And one way to solve that is to allocate those, specifically call out what fully open data looks like, and also the funds that help make that happen.
Fantastic, thank you. Another question is around data infrastructure building, particularly with this assessment. Which is easier to fill, missing data gaps or missing data sharing gaps?
You know, I think it sort of depends, especially with the slide up here, what the barriers are in a particular country. But the data sharing aspect, the hard part, I often think of it like water coming out of a faucet. The hard part's getting the water in the faucet. That's the data. And so the easier part, by no means the easy, like very easy part, but an easier part is getting the water to come out of the faucet. And that's the data sharing infrastructure. So I tend to think of that technically as an easier piece than generating the data itself, because it takes a lot of hard work from governments across the world to keep up that data production in the first place over multi-year periods.
Great, thank you. And then finally, since we have a lot of people tuning in from around the world who are really engaged in air quality work in their respective sectors, I'm wondering if you can share a little bit about how individuals might be able to contribute to this study, as it's going to be given every year.
Yeah, so we would really welcome and invite contributions from the community on improving this data landscape and sort of the collective understanding around it. Various ways that people have already helped and we will seek in the future is getting inputs on data sources that may not be in our radar, maybe that aren't in those sources that we listed. We are a US-based organization, primarily English speaking. I think that creates some biases with where we look for data and where it's accessible to us. And so anyone who can help us fill those gaps is great. When we built we started this report, we actually made a public call for folks to check out the guts of the spreadsheet that we're making that captures this stuff, and we'll do so again and invite very granular help in this whole process. And that can be done through, if people want to connect with us through GitHub or through OpenAQ Slack channel, which we can share later. That those are great ways to connect with us directly, or to send us an email at info@openaq.org as well.
Great, thank you so much, Krista. Now I'd like to turn it over to our next speaker, Sruti Modekurty, who will be sharing about the averaging tool on the OpenAQ platform.
Thanks, Chisato. Let me just share my screen. Cool. And you all can see it, right? Great. So yeah, thanks to Chisato. I'm Sruti Modekurty. I'm the platform lead at OpenAQ. And we've been working on an averaging tool. It's something that the community has asked for a long time. And we finally had some time to actually work on it. The main motivation is that we've amassed, almost 500 million data points, actually more than 500 million data points at this point, from all over the world. And we have this data that a lot of people are trying to analyze, and often the data that exists, it's on an hourly format, so it's like way too much data to actually do anything useful with, and so you end up like doing some analysis, and often you end up averaging a lot of the data. And so we felt it would be really useful to the community if we added an endpoint where they can like quickly calculate across like various spatial and temporal resolutions the averages. So the averaging tool is like still in development. We'll have the beta version out really soon. But basically it'll allow you to quickly and programmatically get averaging calculations for pretty much anywhere in the world that we have data for. And you can basically look for different combinations. So on a daily basis, on a city level or a country level, And it's all in the GitHub repo at the bottom link over there. So definitely encourage you to check it out. Oops. So the methodology, to go over it really quickly, how it works is that we have all the data that sits on S3, and we use Athena, which is basically a layer that sits on top of the data that makes it easy to run SQL queries to like analyze the data and like get specific data that you're looking for. So we run the Athena queries daily that actually calculate these averages. And then for all the different combinations, and then we like store them. So they're like pre-calculated and every day. And the endpoint just pulls from those. So it's not a huge drain on resources to calculate them every time somebody hits that endpoint. And the way that we calculate them is we calculate temporally on a station level first, and then aggregate them spatially. So we'll get the average, for example, if you want the average per month for the city level, we'd first get the average on like for each station for that month, and then aggregate it up to the city. We do some basic data cleaning, so we remove values that are 0 or less than 0, and also equal to 985. That's because a lot of the sensor manufacturers use 985 to indicate that there's an error with the instrument. So we're taking out those values, because then that's going to skew the average. And then it also returns the number of measurements that went into the calculation, because you want to know whether this average that you have is for, like 2 measurements over the course of the year, or if it's actually like reporting regularly. And now I can show you a bit of a demo. So it's still in development, but it will be available. Actually, if I go back to this, it will be available at api.openaq.org/beta/averages. Like the beta version, we'll have that open for a couple of weeks so people can play around with it, give us feedback, and then it'll join the rest of the endpoints at v1/averages. Yeah, so on to the demo. So here you can see like what it generally looks like. You have the endpoint here, and you can query, you have to specify the parameters spatial and temporal. So right now it's set to location and day, which means that it's calculating the average on a station basis for every day. And you can see that here, if I like scroll through this, it's going through some stations that are in Australia. For yesterday. So you're probably wondering how this is useful. Like for example, let's say you're interested in how COVID-19 has impacted, and the lockdowns has impacted air quality, and you're really curious about Italy. You could say, I want to look on a city basis for the month, and then say country equals Italy, and you're like, I don't want all the data, I just want 2020 data, and say date from equals 2021. And then you'll get the average on a city level for every month. So here you can see all the different cities for May. And then just keep scrolling, you'll see them for April. And then here you can see that it gives you the measurement count, so you have an idea of how many measurements went into the calculation. But let's say you're you're a local official, you're in a small town, you want to understand like what the air quality is like day to day in your area. So we can go back to where we were before. Say location, and then let's go on a day-to-day basis. Oh wow, I can't type today. And then I'm interested in Brooklyn. Oh, whoops. That is not what I wanted. Demo gremlins. Averages. Okay, let's go back here. And then I was trying to look for location. There we go. Okay, different Brooklyn than what I was expecting. I was thinking of the one in New York, but here you can see that you have the averages day to day for that specific location, so that it's a lot more usable than getting like hourly measurements, and then you'd have to like hand calculate the averages yourself. But let's say you're like the World Health Organization and you put out the global burden of disease every year, and you need to know like on a country level how how countries are doing on a yearly basis. Normally this calculation would take weeks to do by hand, but with the averaging tool you can do that in a matter of minutes. So I said country, and then temporal, get year, and then I don't want to specify, I want the whole world. Cool, so here you can see the yearly average for 2019 for a bunch of different countries. So Sweden, Mexico, South Africa, etc. And yeah, that is a bit of a demo. I definitely invite people to check it out, play around with it. Once it's released, it'll be out today, hopefully sometime this week. We'd definitely love to get some feedback at github.com/OpenAQ/OpenAQ averaging. And we'd also really love to know, I shared like a few use cases, but we'd really love to know like how the tool could be useful for the work that you're doing. And we'd invite you to answer that in the chat so we can take a look and hopefully, learn more about how this can help the community. With that, I think I'll have some time for questions.
Thanks so much, Shruti. It's exciting to see the potential uses of this tool. It seems like there's a lot of interest from the OpenAQ community. One question actually from a participant wondering if they could see an example using Mongolia data on the demo. And then also a question about how you see this particular tool being useful to the community. You mentioned an example from WHO. Are there other types of uses that you see for the community at large?
Yeah, I mean, we get like a lot of requests for people people trying to understand how to use Athena to get the averages. So I think there's definitely, in academia, there's a lot of use cases, even for like journalism, let's say, like you don't want to have to like actually crunch all the numbers. If you're just interested in looking at, I don't know, like the monthly pollution levels for a specific city, you can just use this endpoint and not actually do the calculations yourself, and use it for like a data journalism piece, for example. Or if you're trying to, you're a community organization and you're trying to advocate for the air quality in your area, similarly, you can just look at the average for the past, I don't know, on a daily basis for the past few months, if there's been, like wildfires or like other events that contribute to air pollution, and like clearly see the picture without having to spend too much time on like actually calculating the averages and like, doing the analysis. And then, yeah, I can show an example for Mongolia. So we could do on a city level, maybe, and then maybe on a daily basis, and say country, and it's MN, right? The country code for Mongolia. yeah, so this is kind of what it would look like.
Great, thank you. Yeah, and I think there was also a question about whether or not we'll be posting instructions on how to use it, and I believe that we'll be posting a blog on instructions on how to use the averaging tool, so it'll be available to the public soon.
Yeah, definitely. Like we're gonna post some instructions on how to play around with it now on GitHub and in like the API docs. And then once we've gotten some feedback, we'll definitely be posting a blog post so that everyone, even people who aren't like familiar with APIs, will be able to use it.
Great, thank you so much, Sruti.
My pleasure.
And now turning it over to our final speaker, Professor Michael Brauer, who will be speaking about the intersection of health, air quality, and COVID-19.
Thanks very much. Now I can't share my screen for some reason. Is that visible now?
Yep.
Okay, sorry about that. So thanks very much for having me here today. And I'm going to give sort of an overview of linkages between COVID-19, air quality, and health. I think there's been lots of media attention on the potential impacts of the COVID-19 response and economic downturns and their impact on air quality. I'm not really going to talk too much about that. I'll focus more on actually the health linkages, but just to start out, this has been covered extensively in the media. I would say in general, there's been a lot of actually rapid and quite poor quality science. So those of you who have long-term experience in air quality, I think it's really important actually to remember what we know about sources of air pollution. And for example, there's many sources of air pollution that have not decreased at all as a result of economic downturns. And obviously they're still contributing to poor air quality. What we do see is consistent decreases throughout most of the world in nitrogen dioxide. And that's because this is a pollutant that's quite specific, especially in urban areas, to transportation pollution. And as economies sort of slowed down, and especially as people were working from home, there have been pretty consistent decreases in the concentrations due to that decreased traffic. For other pollutants, so particulate matter and ozone, for example, the impacts have been much more variable. So they've been variable by location. There are some locations where there have been small decreases. There have actually been examples of increases in some pollutants, and they've also been much more variable over time as a result both of other sources as well as meteorologic phenomenon. Also, in the case of ozone especially, but also to some extent PM 2.5, we know that these pollutants have a component of atmospheric production, so secondary pollution, meaning that what is emitted gets transformed in the atmosphere. And that atmospheric science, or that those atmospheric linkages are nonlinear. So the fact that you actually may reduce a source of emissions by 10% doesn't necessarily mean you're going to get a reduction in 10% in the concentration of the pollutant. And we've seen that again for the example of ozone in some locations. Even the fact that you've decreased one of its contributing pollutants, actually the concentration ends up increasing due to the complexities of atmospheric science. But overall, again, decreases in NO2 and smaller and much more variable impacts on other pollutants. Of course, all of this change as economies re-emerge or emerge from the economic downturn, these changes are temporary, they're not sustainable. And we're already seeing evidence, especially from China being the first country that really faced COVID-19, that levels have really come quite quickly back up to normal. And to some, there's even some evidence that even higher levels, which could be expected as, for example, industrial activity ramps up, pollution control equipment may not be operating at full efficiency in terms of industrial processes themselves. Just sort of a comment on, I've already seen some reports in the literature on estimating the hypothetical impacts on health of these decreases that we've seen in pollution in a number of locations. I would urge all of you to view those very, very cautiously, because what those studies are doing is essentially taking our information on the relationship between a change in a concentration and a change in the health impacts from a pre-COVID era, and applying that to the current situation. And that's assuming that everything else about the population and everything else that affects our health hasn't changed or is similar to what it was pre-COVID. And I think many of you can appreciate that many things have changed for many people. Just for one example, if people are staying close to home, they're spending actually more time indoors in a home compared to perhaps spending time indoors in an office building or in a school that may have very different ventilation characteristics. So the percentage of polluted air that may come into their home compared to perhaps working in an office building would be different. People are spending less time commuting, and in some locations, the level of pollution that you are exposed to during a commute accounts for a huge percentage of your daily exposure. If you've now dropped that commuting exposure, your exposure is sort of different. And then there's also impacts on health more generally. Physical activity levels may be different. Our diets may be different. Stress may be different. So all of these things will actually impact or could impact the relationship between air quality and on health. Now, long term, in terms of what we've seen in improvements in air pollution, there is a hope that this example that people have experienced, and there are examples where in parts of the world people have experienced, because of the economic downturn, they've experienced clean air for the first time in their lives. And people seem to like clean air, which is a good thing. And there is an opportunity for that collective will to say, we like this and we actually don't want to go back to the poor air quality conditions that we had prior to the pandemic. And certainly also an opportunity as many countries are applying economic stimulus measures to actually direct those into types of actions that will shift from a dirtier development or dirtier economic activity to a cleaner economic activity. It's still obviously too early to say what the end result will be, but I think actually quite an important opportunity that could take place to quote unquote build back better. So moving now to the sort of health impacts. There has been information on aerosol, so particulate matter in the air as a transmission vector. The studies really show that you can detect the virus on particles in ambient air, but there's really no evidence that I've seen that suggests that this is either that the virus that is, so it's actually viral RNA that is on particles, that it's actually infective. And really no evidence that that's an important route of infection. Again, even though you can detect the virus on particles in the air. Lots of information on airborne transmission, and what we know is that primarily this virus is transmitted in large droplets that tend to settle out of the air as a function of distance. So the closer you are to somebody the more likely that if they exhale these droplets, that you will inhale them. The farther away you are, the more likely that those droplets will have settled out and also will have been diluted from the air. And this is relevant for what's become a major issue, which is the protection factor related to masks. So the masks primarily work by blocking your own exhalation of these droplets rather than the inhalation of what somebody else has breathed. Having said that, there is partial protection from breathing in viral particles in the air, probably something on the order of 10 to 20%, so actually a small component, but the blocking of what you exhale is close to 100%. And together, on a population basis, in reviewing all the literature, it looks like masks are able to decrease the transmission of the virus for the whole population by about 30%. And even while that may not sound like a lot, if everybody's wearing masks and you get a 30% reduction in the population transmission of the virus, that's actually enough to shift from a reproductive number above 1, which means you actually infect more than one person, to below 1, which is exactly what you need to actually decrease the course of the pandemic. So what I really like to spend most of the time on is the relationship between air pollution and respiratory infections. Now, in relation to, so COVID is a respiratory virus. It causes a respiratory infection. It's still too early to really understand what the direct link is between air pollution and COVID itself. You may have seen several studies reported in the media. These range in quality. There's been some extremely poor science, which really is just comparing levels of air pollution to levels of COVID infections by location. And we know that that actually masks many, many other differences between location to location that will relate to the numbers of respiratory infections. So how old is the population, how much testing is done, et cetera, et cetera. So I would say in general, we really just don't know specifically for COVID what the link is. But we do have lots of examples and mechanistic data for respiratory infections in general. And we know from actually years of research that air pollution can worsen the severity of respiratory infections in general, and by actually dampening our immune response. And so I would say it's quite prudent to assume that the same kind of mechanisms are in place for COVID, although we don't really have direct evidence yet. And these two mechanisms, there's two major mechanisms. One on the right-hand side here is your upper airways, especially, are lined with a layer of mucus and also with cells that have hair-like appendages called cilia. And these are part of our immune response, and they exist to actually trap inhaled particles. These could be air pollution particles, but also viral particles or bacterial particles. They get trapped by the mucus layer, which also protects the tissue from actually contacting the particle. And then these hair-like appendages sweep this mucus upwards, and then you swallow it or exhale it by blowing your nose, for example. And that's a way that we actually can protect these particles, these viral particles, from infecting the lung tissue. In the lower airways, we have specialized cells called alveolar macrophages. And these cells really gobble up inhaled foreign agents. And they can be inhaled foreign bodies, again, such as viruses and bacteria, but also air pollution particles. And the way that air pollution affects our response here is that if you are exposed to a high level of particulate matter pollution, these cells actually become full of particles and therefore are not able to respond to bacteria or viruses. On the upper airway side, what we know is air pollution can actually degrade these cilia, these hair-like appendages. So if you're exposed to high levels of air pollution, these cells actually lose these cilia and then are not able to sweep up, let's say, a virus particle that you may inhale. So what does this all mean? Well, we have studies on the population of short-term exposure to air pollution, and in this case, particulate matter, and the link between that and pneumonia hospitalization. So this means studies where you actually have simultaneous exposure to an infectious agent, in this case, could be viral or bacterial pneumonia, and air pollution. And we see that there's an increase in the hospitalization of children related to the amount of particulate matter they're exposed to. So again, suggesting that mechanism, that if you're exposed to both things at the same time, that infection is likely to become more severe. And just another sort of analogy to explain this, we also see in the literature a link between ear infections and air pollution. And ear infections actually start as respiratory infections. So they start as upper respiratory infections, and then if your immune response is not able to clear that infection, it travels to your ear. And air pollution makes that infection more likely to progress from a respiratory infection to an ear infection, again, making it more likely that you're going to have sort of a severe infection. We also have a phenomenon where there's a relationship between long-term exposure, meaning your prior exposure. So if you happen to live in a location or part of the world has high levels of air pollution, you're more likely to result in a respiratory infection. So this is again suggesting not so much that the simultaneous exposure, but just the fact that you have long-term exposure to air pollution, you're more likely to get a severe respiratory infection. So the implications for COVID would be it's not just what's happening right now, but actually what you've been exposed to throughout your whole life. And so this is just sort of an example of the relationship between the risk of having a lower respiratory infection and a death from a lower respiratory infection on the y-axis, and on the x-axis the concentration of particulate matter. And we have studies now actually spanning the entire sort of global distribution of air pollution, from a very clean setting like Canada to a much more polluted setting, such as countries in sub-Saharan Africa. And even without COVID, we estimate that there's about 325,000 deaths from respiratory infections, pneumonia specifically, that are attributable or linked to ambient particulate matter pollution. So it's actually responsible for about 15% of the global pneumonia deaths that occur. And these are primarily occurring in children 1 year of age and younger, and in older adults, so adults age 55 and older. As you can see on the bottom, there's that sort of bimodal pattern in the deaths linked to particulate matter from respiratory infections. So policy implications from these linkages are that actually this is not the time to worsen air quality, and this is actually the time that it's really imperative for governments to actually keep air quality management, and in fact to enhance air quality management. And I'll just give you one example. Very early on in the pandemic in the region that I live in, that's a time of the year when there's lots of agricultural burning. So we're getting out of the winter time, and we're in a period before we have a risk of actually having fires when things get too dry. So a lot of agricultural burning, and we did some advocacy work and actually got bans on agricultural burning implemented for this period because of the risk of actually having people more likely to have a COVID infection that would become severe, and severe enough that they would then have to seek hospitalization, which is exactly what we were trying to avoid with all the other measures. And so this is going to be increasingly important for example, in the Northern Hemisphere, if we move into the colder period of the year, which in many places is the period when we have poor air quality. It's going to be quite important to try and actually reduce air pollution if we're still having, as seems quite likely, COVID circulating in the population. So a message, again, to sort of inform policy that now is the time to really be very careful on terms of polluting the air. So I think I will stop there, and if there's time, I'd be happy to take any questions.
Thanks so much, Mike, for your presentation. As a follow-up to your slide about informing policy, I'm wondering more broadly, or if there are other examples that you've seen where people are actually using the data that's available on the observations of the changes in air quality trends to really influence policy or even science, and what can we really learn from this data to influence policy, whether it's sector specific? You mentioned working with your community. Are there other examples of the potential uses of this data to really influence change?
Yeah, so the science part is easy because we have a kind of an amazing natural experiment, as I would say, especially focused on transportation, to really see what the impact of transportation is. And I would say that the main sort of science benefit is we have models that try and estimate this, and now we have a direct experiment, which will help us improve our models to say how much, if we get X reduction in motor vehicle transportation in this city, what reduction will we expect in air pollution? And so, for example, I know this has been prominent in India, where in many cities there's sort of a long-standing discussion about how much of the pollution is local versus how much is regional versus how much is coming from one source or the other. And this has been used to really understand the impact on a city-specific basis in the contribution of transportation to air pollution. From the policy perspective, sort of one thing that I didn't say is that we also, we're seeing now that we know that certain diseases, if you have what we would call a comorbidity, so for example, chronic heart disease or chronic lung disease, if you are infected with COVID, you're more likely to, that infection is more likely to be severe, and you're more likely to require hospitalization and very detailed medical interventions. But those same sort of diseases, we know on a year-on-year basis are actually leading to people to die prematurely as a result of their exposure to air pollution. So I think there's an opportunity here, again, just to highlight the devastating impact that air pollution has on health more generally, but also in the situation of COVID, to say that we're now sort of, through air pollution, increasing our pool of people who are most vulnerable or most susceptible to being affected by this virus. So I think really an opportunity to say that we need to continue to focus on air quality. And I always describe air pollution as sort of an equal opportunity killer. Even though we do have issues of disproportionate exposure, we know that if we clean up the air, everybody benefits, which is very different than saying we're going to apply a medical intervention to somebody. Then you have all these issues of access, in some countries, insurance, et cetera, et cetera. If you clean up the air, everybody gets this benefit, no matter where you are, no matter who you are.
Thanks so much. We have a couple questions from the participants. One question from a participant who works in Mongolia. Now that people are learning to wear masks to protect from COVID, how do we convince people to keep wearing masks during air pollution and even when COVID is no longer a threat anymore?
So that's a really interesting question. I would say, in general, what we know is masks that will protect against COVID offer very little protection against air pollution. So maybe you're only reducing your exposure by 10% or so. And that's assuming you're wearing the mask 24 hours a day, so not sleeping with the mask on. So in general, from an air quality perspective, masks are really not a solution. And it's probably the sort of solution of last resort. And we really would be much better off actually focusing efforts on, first of all, cleaning the air, so reducing emissions. Secondly, filtering air with a portable air filter in the home. And then really, again, the third thing would be to wear masks. So while there is an opportunity, the types of masks that people are wearing now, the cloth masks that most people are wearing, really offer very little protection against even just one form of air pollution, and that would be particulate matter, and then let alone gaseous pollutant, where they're really offering no protection at all. So I actually don't think there's too much of a message. What you would need to do is actually have everyone wear these N95 masks and have perfect seals. And we actually know these masks don't even see, many people can't wear, if you have a facial hair, if you're a young child, et cetera, many kinds of issues. And they're just actually too uncomfortable to wear 24 hours a day.
Thank you for clarifying, Mike. Another question is there any evidence that PM can carry the virus in an outdoor air and cause more infection in specifically polluted regions?
Yeah, so I mentioned this very briefly. You can detect viral RNA on particles, but there's no indication that that is actually infectious. So it's just a piece of the virus, and really very little evidence to suggest this is an important route of exposure. So I'll just give you one example, which really has nothing to do with air pollution, but actually talks about outdoor transmission of the virus more generally. So there was a series of cases from Wuhan that were followed up, about 320 cases, and only one of those seemed to be related to outdoor transmission at all. So I would say in general, there's really no evidence to suggest that this is an important route of exposure. What we know is most exposure or most transmission occurs indoors when you're very close to other people, and that's consistent with this mechanism of people exhaling rather large droplets of the virus. So you just don't need any other mechanisms really to explain most of the transmission that we've been seeing.
Great, thank you so much. Unfortunately, we are at time. And so if anyone would like to ask questions following the webinar, if you don't mind, Mike and Shruti and Krista to hang out on Zoom for a little bit. For those who still have questions, please feel free to stay online. But for those who need to go, just wanted to let you know that this is the conclusion of the community series, and would love to thank you so much for joining us, and thank you to all our presenters for a really engaging panel. And we're actually looking for ideas for future community series, so please reach out to us by email and Slack, and we hope that you're all staying healthy and safe, and we're looking forward to staying connected. Thank you so much. See you next time.
So should we try and answer these questions in chat or to
Yeah, it
them
looks
on
like there's
Slack?
2 questions to you, Mike. Yeah, one is about the correlation between smoking and COVID, whether or not they're more susceptible.
Yeah,
And, yeah.
smoking and COVID, it's really not clear yet, but in general, there isn't a lot of evidence suggesting that. What else?
Providing insight on the status of air quality during COVID lockdowns in Africa.
So Oppo, I'll get back to you actually, because we have measurements in Accra that were ongoing, which is probably what you're interested in. So I will connect with you directly if you're still on. That's all for me, right?
I think there's one in the Q&A as well about the use of portable air purifiers. How do you think the use of portable air purifiers will develop as COVID continues and even after it continues? Will it really make a significant difference?
So I actually early on, I was hearing that portable air purifiers were sold out. So people were buying them as protection, but I've seen them in stores actually. So I don't know if that's sort of continued. It's certainly something that we've been recommending for many years, and we continue to recommend from an air quality perspective. I don't know, so to the extent that people bought more of them and will continue to use them, I think that would be a good thing. They really do work and do make a difference, but I just don't know if that really there's any evidence that sort of there's been a massive uptake in purchases, and it hasn't been part of more general recommendations either.
I think that might be it.
Yeah, it looks like that's it.
Questions?
Yeah, thanks for asking or for answering the remaining questions.
Great. Okay,
Great.
I'll leave you all.
Thank you
Thanks
so
very
much.
Yeah, that was
Thank you
great.
so much.
Thanks.
Bye.